The FootHold with Splint is an adjustable ankle-foot orthosis that is used in the prevention and treatment of heel pressure ulcers. It can also be used in the treatment and prevention of plantar fasciitis, and it is an L-shaped splint that helps maintain the ankle at 90 degrees or neutral amount of ankle dorsiflexion. The FootHold with Splint has 2 Velcro straps that go across the ankle to secure the foot within the splint, Velcro around the lower portion of the leg and the lower portion of the foot. Within the splint itself, you'll find the patented hydro cushion. And I'm going to go ahead and take that out and demonstrate its purpose. So inside this material is this flowing gel pack that is used to raise the calf muscle, and it allows flotation of the heel for offloading without increasing pressure to the Achilles tendon. The hydro cushion has a Velcro piece on the back portion to allow it to be adjusted according to the patient's leg length. There are ankle wings also on this hydro cushion that help in protection of the malleoli. The plantar aspect of the splint is a nice, firm, stable surface. It allows for functional ambulation, and it's comfortable. The windows on each the medial and lateral side of the splint allow for visualization of the heel in order for a clinician to make sure that the heel is properly offloaded. The positioning of the splint can help control the amount of lateral and medial rotation at the hip by use of the anti-rotation bar. This anti-rotation bar is unique in the sense that it locks into place, and this helps control the amount of internal and external rotation at the hip when the patient is in supine or lying in bed. The secure stick sole, which is on the bottom of the splint, can be used for a patient to ambulate in the splint, or it can be removed. You have the advantage with this splint of using the anti-rotation bar in one direction and the secure stick sole in the opposite direction to ensure that neutral alignment of the hip. When they're ready to get up and walk, they can simply add the secure stick sole, and they're able to get up and walk. There are no bolts or pins to hold the weight-bearing surface of the splint in place, making it a very stable walking surface and a more comfortable walking surface for the patient. If a patient presents with a significant amount of edema or has compression wraps, which increases the girth of their limb, each FootHold with Splint comes with a strap extender that can be used to increase the circumference of each of these straps. Because the FootHold with Splint fixes the ankle at a 90-degree angle, it decreases the amount of flexibility at the ankle when the patient is moving through the gait cycle. So it is an option for the rocker bottom sole, and this can be placed similarly to the secure stick sole. And it's a nice option for patients who have trouble getting through the stance phase of gait. They are already fixed at a 90-degree angle because of the L-shaped splint. The rocker bottom sole then allows for the patient to roll through the stance phase of gait with ease, allowing them a more functional gait cycle. The FootHold with Splint can easily be applied to a patient lying supine in bed or in a recumbent position by simply removing the Velcro straps and placing the patient's limb inside the FootHold so that it's nice and secure. I want to point out the ankle wings are protecting her malleoli here, which is a really nice feature. Now I'm going to check and make sure that I can get fingers between the straps and her skin. and check the heel through the windows that allow you to visualize the heel to make sure that it's properly offloaded. In this case it is. If you would like your patient to get up and walk, you can simply select your sole of choice. I'm going to choose the traditional secure stick sole and Velcro it in place. Okay, if you want to go ahead and sit up on the side of the bed.